My name is Samantha Foster, and I will be talking with you today about acceptance and commitment therapy, also known as ACT. So, an introduction to ACT therapy. ACT is a form of behavioral therapy that combines acceptance and mindfulness-based techniques with reinforcement-based and behavior change techniques. The primary purpose of ACT is it aims to decrease the effect of psychological distress on an individual, and it seeks to increase access to reinforcement in the form of more valued outcomes. The approach is rather than changing the form or frequency of maladaptive or distressing verbal behavior, ACT transform the functions of those verbal processes. So an example of this is if a client has a mindset that I am a burden to my family. So an example would be to take that thought down, write it down on a piece of paper, and hold it out in front of you. Now the thought is no longer an intrusive thought, and it's just a sentence that you now have in your hands. So that's giving it a different function and a control over that thought. This transformation increases the likelihood of engaging in more adaptive behavior appropriate to whatever current context you're at. The main components of ACT, so starting with mindfulness, is within the ACT model, and it's done through various exercises. So individuals cultivate on observing a non-judgmental self, fostering awareness and acceptance of unwanted private experiences like thoughts and feelings. Mindfulness entails deliberately attending to the present moment, occurrences without passing judgment. So it's how one speaks to themselves. And an example of this is clients are helped see private events as what they are, as behaviors, rather than what they appear to be, which are causes. Acceptance in ACT encourages individuals to embrace their experiences, both pleasant and unpleasant, without trying to change or avoid them. By doing so, they can develop a greater psychological flexibility and make choices that are in line with their values and goals. Value clarification. This component of ACT focuses on assessing clients and recognizing and clarifying their core values, like life goals and objectives. It provides methods not only to identify these essential aspects, but also to understand how they can be pursued and obtained. It dives into distinguishing between values and judgments, emphasizing on the significance of aligning choices with values rather than being driven solely by reasons or external influences. It highlights the connection between values and choices and encouraging clients to make decisions that that resonate with their deeper aspirations, even in the absence of clear rationalization. This process empowers individuals to live authentically and purposely, guiding their actions towards a life that reflects their true values and goals. Commitment of action is the willingness to commit, and it's pretty much putting ACT into action, focusing on assisting clients in actively pursuing their desired life directions. This involves helping them cultivate a mindset where thoughts, feelings, and memories are seen as hindrances to process, but rather as a natural aspect in the fulfillment of the whole life journey. By encouraging clients to embrace their inner experiences as expected components of a rich and meaningful existence, therapists aim to empower them to commit action towards their value goals. This perspective shift from viewing internal struggles as obstacles to recognizing them as integrate parts to a purposeful life path. And it promises acceptance and ultimately progress towards personal fulfillment. Diffusion. ACT teaches to diffuse from anxious thoughts and beliefs, helping individuals recognize that they are not necessarily accurate reflections of their reality. By learning to distinguish themselves from their anxious thoughts, individuals can reduce the power of those thoughts to decrease their behavior. And the self as concept is developing a perspective, taking abilities to foster a stable and less reactive sense of self. So taking all those and putting them together, we're going to be looking at a model done by Burke. And I love this example because it's really bringing the client's interests into play. So using the accept, identify, move curriculum, which is typically used with use, and it includes daily lessons, practice items, and a point tracking system to reference positive and flexible behavior. So within this, The lesson adaptation involved during lessons, and this was all done during telehealth. And it was focusing on James the client and his interest in Star Wars, which is so cool, especially if you're a nerd. Lessons were tailored to incorporate Star Wars themes, animation, and music, aligning with the target core process. For example, a Jedi's journey guided by the values mirrored by ACT processes like mindfulness and acceptance. Each lesson started with a Star Wars themed mindful moment, following an interactive activities facilitated by a graduate assistant. These adaptations aim to engage James and reinforce target core processes through his preferred interests. The accepted identified move curriculum lesson adaptation was used because it allowed for tailored interventions aligned with James' interests in Star Wars, and it increased his engagement and participation in the treatment process. This personalized approach helped reinforce core principles such as mindfulness and acceptance, contributing to the reduction in aggressive behaviors observed during the intervention. So super cool. If you want to look at the examples here, it's pretty awesome. Instead of saying be here now, say what Yoda says, do or not. There is no try. And it's just so cool to nerd out on. So the mechanisms and action of ACT, and it lies in the foundation of the psychological flexibility model seen here. This model is centered around cultivating psychological flexibility, which entails the ability to adapt and comprehend the intricate relationship between one's thoughts, emotions, and behaviors. By embracing acceptance and mindfulness techniques, individuals undergoing ACT learn to observe and accept their inner experiences without judgment, allowing them to distinguish from unhelpful thought patterns and move towards actions that align with their values and goals. Through this process, ACT facilitates a deeper understanding on how individuals navigate and respond to their inner experiences, ultimately overpowering them to lead a more fulfilling and meaningful life. So treatment, why can't I say this word? Indication. So ACT has shown promise in addressing a range of mental health concerns, including reducing uncertainty, avoidance, depression, and symptoms of generalized anxiety disorder among individuals with various mental health issues. Moreover, its effectiveness extends beyond just mental health. It's integrated by successfully applicating in contexts such as cancer, substance use disorders, and even chronic pain management. This versatility underscores that ACT's potential as a therapeutic approach is capable of addressing diverse changes across different domains of health and well-being. ACT's adaptability across age groups, as from all the studies that I will be presenting today, it starts from adolescence and goes all the way into adulthood. So this suggests a potential for flexible intervention strategy for individuals across their entire lifespan. So addressing various conditions, and I'm only going to do a few since we only have such limited time. So starting with anxiety disorders, ACT shows promise in treating anxiety disorders, particularly evidenced by the reduced symptoms in individuals experience. And in the Barbosa case, we could see that it reduces anxiety in individuals with infertility through Barbosa's systematic review. So ACT aims in a culturally psychological flexibility and resilience against anxious thoughts and emotions by emphasizing acceptance, mindfulness, and value-based actions. So firstly, individuals are encouraged to accept their anxiety thoughts, without trying to suppress them, and acknowledging that it's a natural human experience. Using mindfulness techniques foster present moment awareness, allowing individuals to observe their thoughts and sensations without judgment. The value section clarifying, helping individuals identify meaningful goals, align with their values, and promoting a sense of fulfillment. Techniques like diffusion help individuals distinguish themselves from anxious thoughts, reducing their influence. And finally, through combined action, individuals gradually comfort feared situations and embrace and valued activities, building confidence and resilience in managing anxiety. And I'm not going to go through every single one of these with each of the conditions, but I just really wanted to breach on that, which is how that looks like within one. But Going on to depression, ACT addresses depression by helping individuals accept their thoughts and feelings rather than trying to control or suppress them. It engages them to clarify their values and take committed actions towards living a meaningful life, despite the presence of depression symptoms. Through mindfulness and acceptance techniques, individuals learn to observe their thoughts and emotions without judgment, reducing the impact of negative patterns on their mood. ACT also emphasize behavioral activation, encouraging individuals to engage in activities aligned with their values, which can help alleviate depressive symptoms and improve their overall well-being. When it comes to substance abuse, ACT addresses substance abuse by helping individuals accept their initial experience or their internal experiences, and such as craving, urges, and thoughts about substance use without acting on them. It emphasizes the value clarification and commitment act towards a meaningful life and goals rather than focusing solely on reducing or controlling substance use. By fostering psychological flexibility and promoting mindfulness and acceptance, ACT aims to reduce the impact of substance-related thoughts and emotions, ultimately facilitating behavior change and improving their overall well-being. When it comes to chronic pain, ACT is effective in reducing psychological distress, improving quality of life in various contexts. Studies have demonstrated that ACT interventions can lead to a decreased level of anxiety and depression, increased psychological flexibility, and overall well-being among individuals suffering from chronic pain. The therapy, focuses on acceptance of pain, mindfulness, and commitment to value-based actions, helping individuals cope more efficiently with their pain and its associated psychological challenges. When we look at target behaviors, here's a few of them. So starting with aggression. Aggression is used in ACT, and it approaches by targeting psychological flexibility, which involves accepting unwanted thoughts and feelings while committing to actions aligned with personal values. In the case of James, our Star Wars friend, ACT's principles were incorporated to the intervention through Star Wars themed, which with the AIM lessons, and a contingency contract, fostering on mindfulness, acceptance, and commitment action. By improving psychological flexibility, James was better able to manage his aggression behaviors and engage in pro-social actions, leading to a significant reduction in overall aggression. When it comes to avoidant behaviors, ACT addresses avoidance behaviors by encouraging individuals to accept difficult emotions and thoughts rather than trying to avoid or control them. Instead of engaging in avoidant strategies, they may provide short-term relief by maintaining a long-term distress. ACT can help individuals commit to value-based actions aligning with their goals by fostering mindfulness and psychological flexibility. ACT empowers individuals to confront challenges and engage fully in life, ultimately breaking the cycle of avoidance and prompting adaptive coping strategies. When it comes to cognitive inflexibility, ACT appears to have a positive impact on cognitive inflexibility, which is associated with conditions like anxiety and depression. Studies have suggested that ACT interventions can enhance psychological flexibility, reducing cognitive inflexibility and addressing effects on mental health. When it comes to self-injurious behavior, ACT works by prompting mindfulness, acceptance, and commitment to their values. Through ACT, individuals learn to accept difficult emotions and thoughts without judgment and allowing them to break free from self-criticism and avoidance behaviors. By identifying personal values and committing to meaningful actions, individuals develop healthier coping strategies and reduce the urge to engage in self-harm. Ultimately, ACT helps individuals cultivate self-compassion, increase psychological flexibility, and find alternative ways to manage distress, leading to a decrease in self-injurious behavior. So some treatment methods used with ACT, which is basically just going through the ACT stages, which is, starting with acceptance and commitment therapy strategies. So being present in the moment, also known as mindfulness. And this is all taken from the Pankow Heliflex model. I don't know if I'm saying that right, but It's a great model, pretty but basic and yeah, straight from Pango. So being present in the present moment, also known as mindfulness, and that's engaging individuals in the current context rather than being caught up in the past or future events. Acceptance is actively acknowledging and embracing thoughts and feelings without attempting to change their form or frequency. Diffusion is altering the relationship between individuals and their unhelpful thought patterns, creating contexts in which these patterns are more loosely impacted. Self as a concept, developing perspective, talking abilities to foster a stable and less reactive sense of self. Values, clarification, and identification core values to guide decision making and behavior. And commitment action is focusing on purposeful, values driven actions to create successfully larger patterns of behavior aligned with one's value. So treatment works in different ways with ACTS. It really just depends on the individual. So some people may have workbook, some people may have homework, some people may have exercises like I gave in the first example where you write it down and you hold your thought in your hand and you have like a different function from this. And then another great example is using the client's interests, like the Star Wars example for, having mindful thoughts and having that correlated with one of their interests, like, even if they're like, interests, being a nerd in the Star Wars. So administration of treatment. So it typically, the frequency occurs over 6 to 12 sessions, and the study links from the studies that we have, we see in Tahong and Tahali, they're both 8-week sessions, while in Burke, they're 10-week sessions. And this is all going to be considered under the client's treatment plans and their goals. So looking over our treatment outcomes, our positive outcomes indicate obvious psychological flexibility, reductions in symptom severity. So Burke in 2023, intervention was designed to strengthen psychological flexibility while establishing environmental supported value-based contingencies to both reduce aggressive behavior and to allow for increased access to highly valued community experiences that were achieved during the intervention and follow-up phases. Along with mindfulness-based methods are deemed effective for conditions such as chronic pain, both in terms of symptom reduction and improving emotional functioning, which with McCracken in 2014 discussed. When it comes to improving overall well-being, Barbosa talked about how ACT is a potentially suitable approach and effective treatment for parents dealing with infertility. When it comes to the negative outcomes, there is limited research about the potential negative effects. However, Tahong in 2007 recognized some negative effects. Tahong addressed that even though ACT has shown promise in treating marijuana dependence, it's essential to recognize potential negative side effects. So one of the negative side effects is the attribution rate. So there's a high dropout rates, typically are common in marijuana abuse treatment studies, which can limit the effectiveness of interventions and lead to incomplete data. Variable treatment outcomes. While some participants showed significant reduction in marijuana intake, others experienced only partial improvements or resumed using marijuana post-treatment, which is highlighting variability in the treatment response. And then a big one that I think is super important is psychological distress. Despite improvements in some psychological measures of anxiety and depression, ACT may not address all underlying issues for every participant, potentially leading to unresolved psychological distress. And when it comes to ethical dilemmas, the use of clinical interventions like ACT raises ethical dilemmas, particularly regarding the balance between experimental control and participant well-being, such as determining when to isolate the treatment. So the relevance with all of this is, if you want to look at this cute little picture, and it pretty much just shows how to live with your fear, and becoming at peace with it. So if we want to pretend that this little monster here is anxiety, and it's this little girl obviously knows she has anxiety, and she's letting it sit with them. She's feeling the anxiety right now. They're sitting on the couch, they're watching TV, but she asks the anxiety if she wants more tea, because maybe for her, drinking calming tea helps reduce her anxiety. So instead of sitting there and living in fear with her anxiety, she has made peace with it. She understands it's there. She recognizes it's there, that self-awareness. And then she goes, obviously, if I drink tea, it helps me calm down from my anxiety. And it's just it's a different approach. That's what ACT really helps. It has that different approach of being able to look at your, in this case, the fear, anxiety, at a different way of like, okay, it is here. I can't completely make it go away, but this is what I know what I could do to help. Just recognize it and address it with simple measures. So risk of treatments. ACT carries inherent risks in treatment, especially when implemented incorrectly or when the client's psychological flexibility is not adequately addressed. Burke in 2023 highlights several key points regarding these risks. So first, ACT may lead to increased distress for some clients as it involves diving into challenging emotions and experiences, which could overwhelm some individuals lacking coping skills or robust support systems. Secondly, the absence of proper progress monitoring may leave clients feeling stagnant or disheartened, diminishing their motivation and encouragement with therapy. Furthermore, if values of clarification exercises are not customized to align with an individual's unique circumstances and values, clients may feel compelled to pressure goals that are neither personally meaningful nor attainable, fostering feelings for failure or disillusionment. Lastly, there is a few risks of clients developing a dependency on their therapist for guidance and validation rather than fostering self-reliance and applying ACT principles to their daily lives. So these risks underscore the importance of careful implementation and thorough assessment within the framework of ACT therapy. So when it comes to the quality assessment and research, looking at the methodological quality, we see in Burke he uses an A-B design with follow-ups, which is super interesting because normally we see A-B, A-B, A-B designs in a sense, but no, they just do it. But I mean, they see obviously with baseline, as soon as implementing treatment, we see a reduce in his aggressive behavior, and even in a 1 month follow-up from using ACT, it's still saying much lower, obviously, than what we see in baseline. And then even over a year of follow-up, we can still see that they are even lower than the previous follow-up. Following, okay, now we're looking at the quasi-experimental design done by Jolly. And that states that utilizing a quasi-experimental design with a control group is good because of the pre-test, post-test design, and it allows for comparison between interventions and control groups. And as we can see in Tohong, they use a multiple baseline across participant designs with marijuana use, and we can see that the level is slowly going down. I mean, it's pretty variable in these, but we can see in this participant number 3 that had a lot longer of base time, and once he received treatment, we see a lot less marijuana use. And the same with participant 2, while participant 3 probably needed some more time in baseline, but we do see the level and trend go down with all the participants. So strengths in research. So finding across studies underscore a coherent pattern affirming the robust body of evidence regarding the efficiency of ACT therapy and mental health outcomes. These analysts of these studies continuously enumerate the potential of ACT to possibly impact individuals grappling with emotional complexities. Barbosa's 2023 comprehensive review goes over the convergence of evidence providing preliminary validation of the efficiency of ACT under its specific domain. Furthermore, Jahali's 2023 study contributes valuable insights by describing the methodology strength inherited in research design, employing the quasi-experimental framework by a control group. And the study facilitates rigorous comparison essential for discerning the true impact of the intervention. Moreover, the clinical implications gleaned from these studies are profound, signaling a potential of ACT as a pivotary early intervention strategy for addressing mental health concerns. Overall, these findings collectively underscore the promising trajectory of ACT and essential mental well-being aimed in challenges of will also highlight its broader acceptability in diverse cultural contexts. So some weaknesses in the study. There were obviously a lot of weaknesses across all the studies presented, but I just wanted to come and just put together the ones that you see commonly across most of the studies. So obviously a small sample size, and most of the studies are done with a small sample. We see potential biases. So in Jahali, there may be inherent biases on self-reporting measures of mental health outcomes, which could affect the validity of the results. We also see some publication biases in Barbosa, so there may be a bias towards publishing studies with positive results, potentially skewing the overall conclusions of the review. And we see limited generability into Hong because the study's small sample size and specifically focuses on marijuana dependence, limiting the generability of finding a broader populations of overall substance dependencies. And in Burke's study on James remained prompt dependent in many areas of daily living skills, suggesting limited generalization of intervention strategies across settings. So recommendation, my rationale for future practitioners, having long-term follow-up, given the limited long-term information from comprehensive outcome assessments to evaluate the sustained effects of ACT interventions over time. This will provide valuable insights in the durability of treatment effects and information ongoing therapeutic support. Using diverse sample representation, practitioners should aim for a diverse sample representation in research and clinical practice to ensure generalizability of findings across different populations, and addressing biases related to gender, sexual orientation, ethnicity, and socioeconomic status will enhance the applicability of ACT. And the integration of technology with the growing popularity of telehealth platforms, practitioners can explore and innovate ways to deliver ACT interventions remotely while maintaining effectiveness of the incorporating the technically based interventions as demonstrated in the AIM lesson adaptation with our friend, I think James and Burke's study, and particularly for clients with transportation or more mobility limitations. With tailored intervention, future practitioners should prioritize tailoring ACT interventions to individual client needs and preferences, incorporating clients' interest, values, and cultural factors to enhance engagement and treatment outcomes, as demonstrated in the AM lesson adaptation in Burke's study. So my rationale for these treatment recommendations is these recommendations are tailoring interventions aligning with a personalized approach demonstrated in Burke's AM lesson adoption, which increase clients' engagements and adherence. With the long-term follow-up, addresses the limitation of short-term outcome assessments, ensuring a more comprehensive understanding of treatment efficiency. And diverse sample representation aims to mitigate biases and enhance the external validity of research findings. Integration of technology responds to the evolving landscapes of healthcare delivery, offering alternative avenues for accessing and delivering ACT interventions. And here are my resources. Thank you so much for listening. And if you have any questions on ACT, feel free to reach out to me.